Hello viewers, welcome to another vlog, and today's topic is hemolytic anemia. In this topic today I'll talk about what is hemolytic anemia, what are the causes of hemolytic anemia, what are the types, that means what is intravascular hemolysis, what is extravascular hemolysis. I'll be covering all these points in this discussion today. So let's start with the formation of RBC, because to understand what is hemolytic anemia, first we have to understand what is the process of normal formation of RBC. So RBCs are produced from the common myeloid precursor cells within the bone marrow, and during the process of development, first there is the pro-erythroblast, and during the course of development from pro-erythroblast there are different forms of erythroblast like basophilic erythroblast, orthochromatic erythroblast, late erythroblast or normoblast, and there is formation of reticulocyte. Now what is reticulocyte? Reticulocyte is just before the stage of mature RBC. So reticulocytes, they usually contains some chromatin fragments, some RNAs, basically some RNAs, and they can be visualized with the help of some supravital stains. So normally we get reticulocyte in the peripheral blood as polychromatic red cells. That means the normal color of RBC is reddish or pinkish, but the color of polychromatic red cells are somehow grayish or slightly purplish in color, and the reticulocytes that are present in the peripheral blood, they are slightly larger than the mature RBCs. Now just before formation of mature red cells, these reticulocytes, they are released into the peripheral circulation, and in peripheral circulation these reticulocytes, they usually stay for 1 to 2 days before maturing into an RBC. So what is the difference between reticulocyte and mature RBC? The reticulocytes, they contain some nucleic acid fragments within the cytoplasms, but the mature RBCs are devoid of any nucleic acid fragments, and these mature RBCs, they contain hemoglobin that is essential for transport of oxygen and carbon dioxide in the peripheral circulation. So after entering this mature RBC into the peripheral circulation, this mature RBC that stays in the peripheral circulation for on an average 120 days. So the lifespan of mature RBC is around 120 days. So what happens to a RBC when it crosses 120 days? It is destroyed in the reticuloendothelial system. So what is reticuloendothelial system? The system that is concerned with the destruction of the old aged RBCs, and it is comprised of spleen and liver, because in spleen and liver there are some cells known as macrophages, and these macrophages, they are capable of killing old, aged or any damaged RBCs. So in spleens there are a lot of macrophages, in liver there are some macrophages, and these macrophages, they usually target the old aged RBC and they destroy them. But before destroying, mature RBC stays in the peripheral circulation for almost 120 days. This is the normal cycle of RBC. Now what happens? What happens in case of hemolytic anemia? Hemolytic anemia is the condition when there is accelerated destruction of the RBCs. So what does it mean? It means that a normal lifespan of an RBC, that is 120 days, and accelerated destructions means that there is destruction of the RBCs much earlier phase. That means in case of hemolytic anemia, on an average, RBC stays in the circulation for as low as 20 to 30 days. So there is a drop in the count of RBC. So there is also a drop in the amount of hemoglobin, and that leads to hemolytic anemia. So anemia means there is decreased in the number of RBCs, there is decreased in the amount of hemoglobin. But in case of hemolysis, body also tries to compensate this situation by recruiting more and more stem cells to produce RBCs. So there will be more number of the erythroid precursor cells within the bone marrow, and that is known as erythroid hyperplasia. So what is erythroid hyperplasia? In case of hemolytic anemia, the body that tries to compensate by producing more and more RBCs, that means there will be more and more number of red cell precursors within the bone marrow. So if we do a bone marrow in case of hemolytic anemia, which is not usually done, but if we do a bone marrow in case of hemolytic anemia, we find there is erythroid cell hyperplasia within the bone marrow. So by this mechanism, body tries to compensate with the process of RBC loss, but sometimes body cannot cope up with the amount of red cell destruction, and that leads to hemoglobin drop and RBC drop, and that leads to development of hemolytic anemia. Now, before going into the causes of hemolytic anemia, let me tell you there are two basic different mechanisms of RBC destruction. One is intravascular hemolysis, that means there is destruction of RBC within the blood vessels, and another is there is extravascular destruction. So what are the differences between these two conditions? Now let's see what happens in case of intravascular hemolysis. Intravascular hemolysis means the RBC that is lies within the blood vessels. So there are release of the intracellular contents within the blood vessels. As a result, the hemoglobin that is present within the RBC that is released within the circulation, and from that hemoglobin that is broken into heme and globin, and from heme we know that from heme bilirubin is produced. So there will be jaundice. Okay. Now in case of intravascular hemolysis, there is destruction of the RBCs within vasculature. But what happens in case of extravascular hemolysis? Extravascular hemolysis means there is destruction of the RBCs within the reticuloendothelial system. That means there is destruction of RBCs within spleen or liver or organs which are involved in formation of the reticuloendothelial system. So in case of intravascular hemolysis, the lysis of RBC takes place within the blood vessels, and in case of extravascular hemolysis, the destruction of RBC that takes place within the spleen or liver. Now what happens? What are the causes? What are the causes of hemolytic anemia? First, one of the commonest cause of first I'll be talking about the causes involved in the extravascular hemolysis. So the first cause, that is autoimmune hemolytic anemia. Now what is autoimmune hemolytic anemia? In case of autoimmune hemolytic anemia, there is formation of some antibodies, and here if the antibody is of IgG type, that IgG type of antibody usually coats the RBC. That means it forms a layer of antibody on the surface of RBCs, and that antibody coated RBCs can easily be trapped by the macrophages within reticuloendothelial system. So this RBCs which are coated with IgG, they are easily trapped by the macrophages present in spleen or liver, and those coated RBCs are quite easily destroyed within the macrophages. And after destruction, there will be formation of heme and globin. Heme will also form the bilirubin, and that will cause jaundice. So this is autoimmune hemolytic anemia. So in case of autoimmune hemolytic anemia, there is coating of the RBCs, and those coated RBCs are easily destroyed within the macrophages. Now the next cause, that is hypersplenism. Hypersplenism means the spleen is hyperactive. That means the normal function of spleen is to clear the old, aged, damaged RBCs from the circulation. When it is activated, when it is hyperactive, then it can easily kill a lot of RBCs without proper stimulation, without proper fulfilling the proper criteria. And in case of hypersplenism, there is also destruction of the RBCs. There is also formation of some hemolytic anemia. Now there are some parasites which can also cause extravascular hemolysis. There is one of the commonest cause of extravascular hemolysis is hemoglobinopathy. Now what is hemoglobinopathy? Hemoglobinopathy means there is abnormal form of hemoglobin. So it can be hemoglobin C, it can be hemoglobin S. Now hemoglobin S is sickle cell hemoglobin. Now hemoglobin S is that form of hemoglobin that can easily polymerize in some deoxygenated state. That means the hemoglobins are easily polymerized, and that polymer of hemoglobin that can alter the shape of RBC from biconcave disc to sickle in shape. That means there is formation of the sickle cells in the peripheral circulations, and these altered RBCs are quite easily trapped and they are destroyed within the spleen and liver. Also, there is another abnormal form of hemoglobin that is seen in case of some other hemoglobinopathies. But thalassemia is another common condition when there is inadequate production of normal hemoglobin. That means there are inadequate production of hemoglobin A, and these precursor cells within the bone marrow, they are lysed, and that also causes hemolytic anemia. Next cause of hemolytic anemia, that is red cell membrane defects. As we know that there are a lot of proteins within on the surface of RBC, and these proteins are involved in maintaining proper biconcave shape of RBC. So if there is any change or absence of these proteins on the surface of RBC, the RBC membranes, they become quite fragile and they can easily be lysed. So what are the options? What are the types of red cell membrane defects? There are hereditary spherocytosis, and here also there are some protein defects like ankyrin, protein 4.8. A lot of proteins are there which are defective or they are less produced. That can lead to formation of microspherocytes. Also hereditary eleptocytosis or hereditary stomatocytosis, these are also some forms of red cell membrane defect. All they can cause hemolytic anemia. So these are the common causes of extravascular hemolysis. Now coming to the intravascular hemolysis. Now one of the common causes is mechanical hemolysis that occurs usually in case of metallic heart valves. As we know that there are some heart valves which are metallic in nature, and whenever an RBC passes over the metallic valve, they are quite easily damaged, and that damage can cause lysis of the RBCs within the circulation. So there is intravascular hemolysis. The next cause, that is MAHA or Microangiopathic hemolytic anemia. Now what is microangiopathic hemolytic anemia? In case of microangiopathic hemolytic anemia, in small circulation, in very small vessels, there are formation of some thrombus, some formation of some fibrin deposits, and that formation of thrombus or fibrin deposit, they usually narrows the diameter of the small vessels. So here there are formation of thrombus, there are deposition of some materials within the vessel wall, and that makes the lumen narrow. So in this narrow lumen there is difficulty in passing of RBCs. So here while passing, the RBCs are lysed. So this is one form of intravascular hemolysis, and this is known as microangiopathic hemolytic anemia. There are two conditions. The first one, that is hemolytic uremic syndrome or HUS, and the another one, that is TTP or thrombocytopenic purpura. So these are the common conditions which are covered under microangiopathic hemolytic anemia. Now next cause of intravascular hemolysis, that is PNH. PNH, what does it mean? It means paroxysmal nocturnal hemoglobinuria. That means in night there is fall of pH, and in normally there are some proteins or molecules which are present on the RBCs that prevent the activation of the complement pathways. But in case of PNH, these molecules, they are absent or reduced. So there is activation of the complement system, and that causes lysis of the RBCs, and it usually occurs during night because there is fall in the pH. So there is fall in the pH and there are no molecules that prevent the activation of the complement pathway. So there is activation of the complement pathway, and by activation the RBCs are lysed. So during morning, what we find, there is presence of dark colored urine in the morning. So this is known as PNH. Next is osmoticlysis. If by mistake we give hypertonic saline in excess amount, that hypertonic saline can also cause hemolysis. So that is known as osmotic hemolysis. Next is transfusion reaction. If there is any mismatched transfusion, that means if we transfuse, suppose, blood group A to a person with blood group B, so there will be a mismatch in the ABO antigen, and that will cause lysis of the RBCs within the blood vessels. So during mismatched blood transfusion, there is also intravascular hemolysis. Next is G6PD deficiency. G6PD deficiency, what is it? It is one enzyme. Glucose 6-phosphate dehydrogenase is the enzyme, and this enzyme is quite important in the process of prevention of injury from free radicals. This enzyme is so important in preventing damage of RBC by free radicals. This enzyme helps to neutralize the free radicals that are produced within the RBCs. When this enzyme is deficient, that means that G6PD enzyme is not in adequate amount, then there will be lysis of RBCs in any kind of stress. That can be due to any infection, that can be due to any physical stress, that can be due to any drugs also. So in case of G6PD deficiency, we usually find that some person with the G6PD deficiency, he or she is taking some medications, and after taking that medications, he or she is having hemolytic anemia. There is sudden drop of hemoglobin, there is hemoglobinuria, or there is some amount of jaundice. So these are the causes of intravascular hemolysis. So the basic difference between intravascular hemolysis and extravascular hemolysis is that in case of intravascular hemolysis, the RBCs are lysed within the blood vessels, but in case of extravascular hemolysis, the RBCs are lysed within spleen or liver. So in case of intravascular hemolysis, there is release of hemoglobin within the circulation, but in case of extravascular hemolysis, there is no release of hemoglobin within the circulation, and that released hemoglobin, that can form hemosiderin in the urine, and that will turn the color of urine into brownish in color. So these are the basic differences between intravascular hemolysis and extravascular hemolysis. Please tell me in the comment section if you have any query regarding this topic. If you find this video helpful, then also give us a comment so that we can improve ourselves in our upcoming vlogs. If you like this video, then don't forget to give us a like. If you are new to my channel, then don't forget to hit the subscribe button, and also don't forget to hit the all notification bell button, because whenever I upload this type of content in YouTube, you will be getting a notification instantly. Okay, that's it for now. Thank you.